Well, thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we are welcomed by Tom Dahlborg, who is the president and CEO of Dahlborg HealthCARING Leadership Group. Thanks so much for being here, Tom.
Thrilled to be here. Thank you for the opportunity.
We just had a lovely conversation for our interview, and now we have one more question for our one question segment. And there were so many great things that we could have incorporated, but it really stood out to me that you were talking about the healthcare system going from provider-centered to patient-centered, and now you're working to help it become relationship-centered, which is perfect because we're so focused on inclusion, and that is an inclusive way to think about everybody in the system. Everybody's going to be a patient at some point, whether you like it or not, for one reason or another. So that's going to hit them. But also the providers go into this because they want to do this, not because they think, you know what, I'd really love to spend like a really long time in school, accrue a lot of medical debt, school debt. And then I think I would like to live a completely miserable lifestyle where I'm not helping anyone and we're not reaching outcomes, right? That's not what happens. They go into it because they're like, I can make a difference. I can help this. I've lived this experience for me or my family. So this relationship centered that puts everybody at the center has to be hitting those buttons for them where they're cared about and allowed to care for the people that they are providing medical care to in the best possible ways to lead to those outcomes. So how is this going to transform outcomes and potentially even a profit for all of the healthcare systems? Because I think that's always a challenge. How are we going to get there financially? Why is this worth it for us as a system?
No, it's a great question, and I appreciate it. So yes, we've gone from provider-centered to patient-centered. We're still trying to get there. The relationship centered is the next phase. And as we talked about earlier, I mentioned how it's becoming a transactional relationship-centered care model. We'll evolve it even further to a love-centered care model. When we love everyone in the system, we're loving the valet, we're loving people in registration, we're loving the patients and families, of course, we're loving the doctors, we're loving the nurses, because when we truly love and then have the evidence and the systems design and so forth, we will utilize all the tech, all the science, all the evidence to position all of these folks for the optimal outcomes, to honor their callings if we're a provider or a part of that care team, to heal or to have the best dying journey if that's the journey that we're on as well. And you mentioned at one point about diversity and equity and inclusion and belonging. When we love all, by definition, we love all. So we'll move forward with it. It won't be, well, I'm going to hire somebody in the C-suite to own patient experience. I'm going to hire someone in the C-suite to own health equity. I'm going to hire someone in the C-suite to own diversity. No. Well, maybe if they're part of a larger system that's a loving system that truly believes that we can make a difference and will invest in making a difference. And when we think about healthcare, and again, I was a CFO, it's not just bottom line. It's that balanced scorecard, or it's the quintuple aim. We should be and must be measuring all components of the quintuple aim, which also includes the value of what we're bringing forth. And if we think about physician and provider burnout, that costs money and leads to harm. As an example, when we think about where the health inequities within the system, it harms all. We can fix it all in a loving centered model that balances all the above.
Is there a shout out that you would give to anybody who you think is really excelling at this, whether this is an individual nurse or a doctor or health system? Is there somebody that you think is excelling at this already?
I would say that Denise Wiseman and the the patient experience community, PX community, they are doing wonderful things in the relationship-centered care space. They're balancing it with the tech and the science and the evidence and the data and moving in the right direction. And I just think they're a terrific organization that, again, is doing special things. They're doing it for the right reason. They're not doing it to make a buck. They're doing it because we can help all.
The point I think you're making is what I want to underscore, is that the risk is that as we implement all these amazing solutions, incentive models and value-based care and quintuple aim, all of these are intended to try to improve the healthcare system and to create good outcomes. And now we have health equity and diversity, equity, and inclusion, also intended to have good outcomes. But I think what Tom is pointing out is that all of these unfortunately wind up getting implemented as transactional systems, check the box. And so now you have diversity, equity, inclusion initiatives that are not really meeting the mark of what Tom's talking about, ultimately, where we're embedding the love, compassion for all into the way in which we just think and lead and operate and breathe. So I guess it's a little bit more of a commentary and a caution that whatever it is we implement, if we're still not implementing it with the right intention, we're still going to get ultimately a mechanistic outcome, and it's only making our system more and more complex. But Tom, would you care to maybe add a comment to that?
Absolutely. Compassionomics, a brilliant book by brilliant people with great intention. What I've heard in the marketplace is if I was going to say, direct my people to be compassionate, we'll make more money. No, you've missed the entire ethos of that book, that message of that book. The message is be compassionate for compassion's sake, love for love's sake. When you do that, you'll achieve all the other goals, but don't do it to achieve a better bottom line. Do it because you truly care. And in fact, Pantea Vahidi has said that when we're compassionate because we want people to do more or whatever it might be, I love how she said that becomes an agenda. It's not a selfless act of compassion. It's an agenda to achieve an outcome as opposed to, I truly love. And we simply need to get to the place of, I truly love, and honor that and honor all who truly love, and then we'll help all, and all will benefit.
Thank you so much. We really appreciated this. This is such a great conversation that we could have for hours. Thank you.
Thank you. Thank you both.
Thank you, Tom.
And thank you all for watching. We'll talk to you soon. Bye-bye.
Bye.